every day on 11 Alive News.
The next time you see severe weather, safely snap it and share it with 11 Alive News using Near Me on the 11 Alive News app.
Here's a photo of the storm that a viewer sent to us.
Download the 11 Alive News app to use Near Me.
News happens fast. Stream it faster. 11 Alive News is now on Roku. Stream live newscast.
We begin tonight with breaking news.
And watch on demand.
We are tracking severe storms.
11 Alive News. Stream now on Roku.
It's tougher than ever to tell if something on social media is fact or fiction.
That's what makes 11 Alive News different. We verify, and we're the only ones in Metro Atlanta doing it.
Verify takes stories and claims that have gone viral, sources that information, and then we vet it with the experts.
So you can be confident you're getting the facts every time.
If you haven't watched Verify, see the difference on the 11 Alive Morning News and at 11 p.m.
Good morning. I would like to begin by thanking the media for joining us for this important virtual Joint Health System press conference today. Thank you also to our community members who are watching the live stream of today's event. My name is Katie Kirkpatrick, and I serve as the president and CEO of the Metro Atlanta Chamber. 6 major health systems from across Metro Atlanta are here today with physician and nurse leaders to bring you the latest on the current COVID-19 surge from the front lines of the pandemic and to encourage the public to please take the prevention efforts seriously. These health systems have collaborated throughout the pandemic at many levels for more than 2 years to share best practices, as well as to support, educate, and inform all of us on the ongoing COVID-19 crisis. Just last August, these health systems held a first joint COVID press conference during the fourth wave to share the reality and stories from the front lines of their hospitals. Today, as we continue to navigate the now fifth wave of the pandemic here in Georgia, these healthcare heroes are here to provide updates, to ask once again for the public's active support, and to remind us all that we are still in a crisis and a global pandemic that is significantly impacting our communities and our health systems. The health systems joining me today issued a joint press statement on December 29th with detailed information and safety measures that will help us get through the current surge and the pandemic together. Everyone can play a role in enhancing the health and wellness of the people in our communities. Our health systems and healthcare heroes have been working tirelessly throughout this pandemic. To give you perspective on how this surge has impacted Georgians, I will share that according to the Georgia Department of Public Health, on January 7th of 2022, alone, 21,271 confirmed PCR cases were reported. By comparison, on January 8th of 2021, 10,165 confirmed PCR cases were reported. As the numbers clearly indicate, this wave has caused a dramatic increase in our single-day records from previous surges and has put incredible additional strain on our healthcare providers and systems, as well as on the people and the communities they serve each and every day. While many have been talking about the mild nature of the Omicron variant, the fact is that more people are getting sick, and this is a problem for healthcare workers at healthcare systems like those represented here today. I am proud to be joined today by these esteemed healthcare leaders from the front lines who will share their perspectives and data points, as well as specific calls to action for all of us. So joining me today are Dr. Danny Brandstetter, Medical Director of Infectious Disease and Infection Prevention for Wellstar Health System. Dr. Andrea Andy Shane, Division Chief of Pediatric Infectious Diseases, Children's Healthcare of Atlanta, and Chief of Pediatric Infectious Diseases for Emory University. Sharon Pappas, PhD and RN, Chief Nurse Executive for Emory Healthcare. Dr. Jane Morgan, Executive Director, COVID-19 Task Force, Piedmont Healthcare. Dr. Robert Jansen, Chief Medical Officer and Chief of Staff for Grady Health System. And Dr. Supriya Manapalli, Medical Director for Infectious Disease, Northeast Georgia Health System. So each expert will speak for about 5 minutes to share their perspective on the current COVID surge. And at the completion of this program, we will have a brief Q&A. Please make sure that you enter your questions in the chat feature as we move through the program. I will begin by introducing Dr. Danny Brandstetter, the Medical Director of Infectious Disease and Infection Prevention for Wellstar Health System. Dr. Brandstetter, I will turn it over to you.
Good morning. Thank you, Katie. It is my honor to represent Wellstar today on this important health briefing. I hope to provide you a perspective of what we're seeing throughout our health system and in our hospitals, along with thousands others of healthcare providers and caregivers during this pandemic. You're all very aware of the ongoing surge that we're seeing now, the skyrocketing number of cases in our communities and the hospital admissions. This fifth wave has been incredibly challenging as we've seen the easy transmissibility of Omicron impact the basic services of all our lives, including transportation, sanitation, and yes, healthcare. I'd like to provide you with some updated numbers of what we're seeing within our hospital. In doing so, I'll take you on a journey with a patient and a true story of a family's interaction with healthcare during this pandemic. We meet our patient, who's a 70-year-old gentleman. It's a typical morning, and he calls his daughter, who lives in his same neighborhood. You see, he's fallen and needs assistance. Living in the same neighborhood, his daughter immediately goes over and checks on her father. And instead of activating EMS, she realizes that he needs assistance getting up, but she's able to help him to her car and she drives him to the hospital. While there, she learns that there are restricted visitation because of high levels of transmission in the community. She learns that at Wellstar Health Systems, there's currently 686 patients admitted with COVID in the health system. She also learns that a lot of people, like her father, are admitted for other reasons, but also subsequently diagnosed with COVID. She hopes this is not the case for him. She also learns that 69% of the patients admitted of COVID positive are unvaccinated. And 118 of those who are COVID positive required ICU level care, and 76% of those are the unvaccinated. 60% of people in the ICU, 60 number of patients admitted to the hospital with COVID requiring ICU level care are also requiring ventilator support. And an increased number of those, are percent 78, are unvaccinated as well. As she waits for news on her father, she subsequently learned he suffered a hip fracture. And yes, his fall from dizziness and weakness was contributed from a new diagnosis of COVID-19. Our story doesn't end there. You see, his daughter subsequently comes down with COVID-19. And 8 other family members subsequently, from this one incidence of healthcare need, is subsequently diagnosed with COVID-19. One pauses to ask, what if? You see, this family, unlike any others in our community, relatively healthy, all eligible, all 10 members eligible for vaccination, yet none received their vaccinations. Because they interacted with each other on a family basis and regular routine, precautions were not taken when interacting. So mask wearing was rarely used amongst these family members when circulating in the community, and no precautions about gatherings or large groups was adhered to. You see, the story has a devastating ending. That family no longer has 3 family members present because of COVID-19. This is a striking number of people who died from one single family out of infection from COVID-19 in one incidence, 30%. While one would be devastating, we hope that no one succumbs to this illness and no one needs hospitalization. One continues to ask, what if? How might this have been prevented? Well, certainly vaccination is our best prevention, and we'll continue to learn about that today from other speakers. But also wearing a mask, washing your distance, and washing your hands are also very important. I understand there's a lot of confusion about masks out there. First key point I want people to remember is snug fit. It's got to fit tightly against the face, no matter what fabric it's made out of. We know and have learned that the specialty fabric making N95s and KN95s are our best fabric to use if that's available to you. If not, it's multiple layers of a snug fitting mask that provide your best protection. Certainly getting medical attention if you're symptomatic, getting tested early, and getting treatment early are very important. We'll learn more about that today as well. But also, if you've been exposed, make sure you quarantine and get screened by getting tested, either a home test or at your local healthcare institution. I think these are very important because, see, these could have helped this family survive and avoid the devastation which has happened. These are heartbreaking stories that we see every day. As one of the largest health systems in Atlanta, we see a great deal of misinformation and try to provide new, correct and accurate information to our communities. I understand that there's a lot of mixed information, rapidly changing data, and recommendations coming out from trusted sources. I want to thank you for your flexibility, your understanding, and yes, your resilience, because we're all navigating this together as we combat this pandemic. My first ask is that you take care of yourselves and one another by getting vaccinated and participating in these protective measures such as wearing your mask, watching your distance, and certainly avoiding large crowds. If you're ill, stay home. Wellstar Health Systems is proud to serve its communities and ready and available to you today and every day. And we thank you for your support and your partnership as we lessen this devastating impact that COVID-19 has had on our communities. I'll now turn it over to Dr. Shane, the Division Chief for Pediatric Infectious Disease at Children's Healthcare of Atlanta and Emory University.
Thank you, Dr. Granstetter, for that very, very powerful message. And I have a lot to echo in that. And thank you for really setting the stage with those really key, important points. I'm very proud to represent Children's Healthcare of Atlanta. As many of you know, we are a 3-hospital system with over 650 licensed beds, just to put some of the information that I'm going to provide into perspective. And although I'm here today, I represent a team of thousands of people who have been taking care of children. And similar to Dr. Branstetter's story, we have been taking care of a number of children. Omicron has really disproportionately affected children, and more than the Alpha or the Delta surge, we are really facing a tremendous challenge in taking care of children. Just as a little bit of context, in the United States, over 9.5 million children have tested positive for COVID-19 in the United States. This is also the 23rd week in a row that over 100,000 child cases have been added per week. Georgia is the 15th state in ranking in terms of cumulative child cases. Here at Children's, as I mentioned, we had a surge in August, September, where we had about 10 to 12% of the children who were hospitalized in our hospital with either acute COVID or complications resulting from COVID. And the rate of positive tests ranged up to between 10 and 20%. In comparison, during Omicron, our test positivity rate has been over 50%, and our census has ranged up to 17% over the past 4 to 5 weeks. We've had over the past 3 to 4 weeks more than 100 children with COVID-related complications, representing both acute COVID infections and continued hospitalizations for complications of COVID-19. Noted specifically in children as a post-infectious complication after COVID-19, known as multi-system inflammatory syndrome in children, or also abbreviated as MISC. To date, we've taken care of over 400 children in the Children's Hospital system who have been diagnosed with MISC. And while this does represent a small number of the total number of hospitalizations, children with MISC not only have complications that we take care of when they're in the hospital, but also may have some complications afterwards. So the way to prevent MISC is to prevent COVID-19. We are very fortunate that over the past several months, children have become eligible for vaccination. And now every child over the age of 5 is eligible for vaccination. Children 12 and above are eligible for a vaccination series, as well as a booster. Vaccination has been the mainstay in prevention of COVID-19, hospitalizations, and the post-infectious complications that I described. Less than 5% of our children who are eligible, age eligible, or condition eligible for vaccination have required hospitalization, meaning that over 95% of the children who we've seen in the hospital who are age eligible for vaccination have not been vaccinated. Once again, emphasizing the importance of vaccination in preventing hospitalizations. I also wanted to mention the importance of other mitigation efforts, such as masking, and also physical distancing and choices about social gatherings. These are extremely important for children, especially as I mentioned, the children under the age of 5 are not currently age eligible for vaccination in the United States. Therefore, those children are completely dependent on those people around them to make sure that they are vaccinated so that they can, in fact, provide the most protection through mitigation methods other than vaccination to these children. This cocoon method really helps to protect children who are currently age ineligible for vaccination. I also wanted to mention that we've noticed both here at Children's in Georgia and around the nation that the number of children who are being admitted for hospitalizations are becoming younger and younger, especially during the Omicron surge. And this directly reflects the fact that those children are not able to be vaccinated. So if I could just please leave you with three really important thoughts. The first is vaccination, and I've said it many times, but please, everybody needs to be vaccinated, and most importantly, boosted as well if you're age eligible. This is really the mainstay of prevention and the foundation for keeping our children healthy. The second is universal masking whenever you're outside the home in every activity. And then also, in addition to the clinical and hospitalization rates that we've seen in children, I also wanted to mention the tremendous burden that children have experienced during this COVID-19 pandemic that extends beyond the number of hospitalizations, that extends beyond the data, that extends beyond the numbers. And so we need to do everything that we can coming together as a community to make sure that we protect the most vulnerable, our children. Thank you. I'd like to introduce Shannon Pappas, who will present next for Emory Healthcare.
Thank you, Dr. Shane. That's some pretty sobering information about our children. So thank you for bringing that forward. And I also thank all of you for joining us for this virtual media briefing today. My name is Sharon Pappas, and I have the privilege of serving as the Chief Nurse Executive for Emory Healthcare. I also had the opportunity to present to the community when our respective healthcare systems came together to address the COVID-19 surge and the importance of vaccinations in August of 2021, almost 5 months ago to the day. Unfortunately, today, I'm sharing a similar message, one that I cannot stress enough. As we mark nearly 2 years of the COVID-19 pandemic and the fifth surge, hospitals continue to remain overwhelmed with patients in the metro Atlanta area. At Emory, we are seeing not only a high volume of COVID-19 patients who are unvaccinated, but also a number of other patients who are coming in for many types of care, surgeries or emergencies. And some of these patients may also test positive for COVID and need additional care for that. Like other hospitals throughout metro Atlanta and around the state, emergency departments remain busy for urgent and non-urgent situations, and wait times can be long. While our health systems have best practices in place to provide high quality patient care and manage capacities at our health systems are stressed, and our healthcare teams are stretched. When I talk with our nursing team here at Emory, and I walk the hallways of our hospitals and clinics, I witness incredible courage, creativity, and just excellent care being provided to our patients. I also hear the frustration in our nurses' voices, and I see it in their faces. Frustration when they cannot provide the critical care to patients that they need in order to meet the patient's every need. I hear and see frustration when our care team members have to restrict visitors and deny access to the patient's loved ones due to the increased COVID protocols. I hear and see the frustration when our care team members face anger and verbal criticism from those we provide care to. While we understand that everyone is stressed by the extra restrictions and increased wait times due to the pandemic, it is still difficult to be on the receiving end of that behavior. I see and hear a mix of frustration and compassion when our care team members have to work extra shifts when they're tired because other care team members have fallen ill with COVID themselves. As I referenced in August, staffing shortages throughout healthcare remain a concern. We are seeing many nurses and clinicians leave the profession or pause their careers because of the stress the pandemic has caused both personally and professionally. Decreases in staffing directly correlate to our ability to provide access to care for the many patients and families who depend on us daily. Our hospitals are doing all we can to bring in additional staff everywhere we need it. We need everyone to do their part in the fight against COVID-19 and keep critical health services available to those who need it most. To keep emergency departments available to individuals who have the most critical health needs, individuals should obtain care at the most appropriate medical facility for their condition and seek COVID-19 testing at primary care locations, public health, and mass testing sites, or use in-home testing kits. Please remember that emergency departments are for those seeking examination and treatment for medical emergencies, not for routine COVID testing or even mild symptoms. Use at-the-home testing kits, public health testing locations, or independent testing facilities if you need to be tested for COVID-19. That is, unless you're ill and need medical care. For routine COVID-19 tests, you can find a location near you on the Georgia Department of Public Health website, or go online to order free at-home testing kits at USPS.com. Please also anticipate increased wait times for medical services. Due to the influx of patients and increased demands placed on our healthcare workforce, we ask everyone who enters our facilities to practice patience and kindness with each other and with our care team members who are providing expert, compassionate care. Thank you for your time today. Emory Healthcare's top priority, like all of my colleagues here, is to provide safe, quality care and treatment to all of our patients. We're grateful to our many care teams and clinicians who continue to stand strong and fight this battle with strength, determination, and grace. Again, thank you for being here. And now I'll turn it over to Dr. Morgan.
Thank you very much. My name is Dr. Jane Morgan. I represent Piedmont Healthcare. And one of the things that we've seen within our healthcare system is the average length of stay vary between these variants. And so when we look at this ancestral strain that originally became 2 years ago, average length of stay in the hospital was 8 days. At the next surge, our average length of stay decreased to 7.1 days. With the third surge, 7.4 days, and then peaked with Delta, average length of stay in the hospital at 8.5 days. What we see now with Omicron is a drastic reduction in the average length of stay in the hospital of 5.8 days. And that is in recognition of the decreased severity of this particular variant. But we should not take this lightly and in fact reject the narrative that this is a variant that we should minimize. If it were not for the decreased severity of this variant, because of its increased transmissibility and the increased absenteeism that we are experiencing with our physicians and other healthcare workers, we surely would have overrun and overwhelmed our healthcare system. One of the things that I am asked frequently, Dr. Morgan, I am exhausted. I am tired. I am anxious. I am concerned about my children. I'm not sure what to do. We tend to see the landscape and the data continue to change and the recommendations. Shouldn't I just go ahead and intentionally get COVID and get it over with, especially with this particular variant that seems to be less severe? And here is why that is not a great idea. We see with Omicron so many mutations on this spike protein until it has negated 2/3 of our medical therapeutics of monoclonal antibodies. We now only have one therapy that is effective against Omicron. That has created a supply shortage. We also see with our anti-COVID pills, the Paxlovid and Molnupiravir, that we also have supply issues. And so if you present to the emergency room and to the hospital, physicians, unfortunately, are in the position of having to triage care, which is demoralizing to all doctors. We are all trained to treat and save everyone. But if we are in a situation where supply is not available, we now have a variant that has challenged our medical therapeutics such that all of them are not available. And also new therapeutics have not become accessible, then we are in a position of triage, which is not a great position to be in. The other thing to think about, if you are thinking of going out and getting this particular variant anyway, is long haul syndrome continues to be very prevalent. And not only is it prevalent, we still have no treatment for it. We have no way to identify who will move on to these long haul symptoms, and we have no way of preventing it. And this crosses all types of demographics. And so even though your initial infection may be mild, the irony is you may find yourself much sicker down the road with cardiac palpitations, shortness of breath with climbing stairs, memory fog, difficulty with memory that may lead to disability or difficulty on your job and in school. The other thing to think about is our children. As scarce as these therapeutics are for our adult population, these therapeutics are not authorized for children, and so they do not even have the option of having them available. And so why would we risk this population that has no opportunity for all of these new therapeutics that are coming about? We also must be concerned with millions of people being infected throughout the world, that each infection represents an opportunity for this virus to replicate, to mutate, and to create yet another variant. We do not want to continue to contribute to these infections by having intentional infections. And so when you add all of these things together, that we have a decreased effectiveness of our monoclonal antibody supply, that we have an access issue with our anti-COVID pills, that we have staffing issues with physicians and nurses being out of work because of positivity, that we run the risk of variants developing beyond Omicron. This is a terrible idea. This is a terrible time to be considering a strategy such as this. You could be the one who presents to a medical facility, and we are having to triage care because of supply and demand. This is an absolutely terrible idea. The other question that I often get, Dr. Morgan, is with regard to quarantine and isolation. And what I want to emphasize is that I have seen time and again people travel even though they are symptomatic. And the justification is that they did not have a COVID test that was positive. And so they wait until they get home and then they test. The test is positive, and at that time they began their isolation. But the fact of the matter was their symptoms began before they began to travel. They chose not to test such that they would not have that information. And so what we need to emphasize is that a lack of a test does not equate to a lack of infectivity. Just because you either do not test or maybe you don't have access to the test doesn't mean that you don't have COVID. And in fact, if you have symptoms that are similar to a cold and similar to a flu in the middle of this particular variant that is the most highly transmissible and contagious that we have seen to date, then you must assume that you are COVID positive and make certain that you take every precaution to protect yourself, to protect your family, to protect all of those around you. We want to make certain that people understand that vaccines are available. We still see this trend, not only at Piedmont, but in other hospitals throughout the state, throughout the United States, and throughout the world, that the majority of people who are hospitalized and who are in the ICU remain the unvaccinated. And so even though our vaccines are under challenge, they have been a success. Even though Omicron has been able to evade some of our vaccine properties and block transmission abilities. These vaccines have still kept us, by and large, out of the hospital and certainly out of the morgue. And so we want to continue to make certain that people understand the value of these vaccines and that we also understand the importance of public health measures, wearing a secure and tight-fitting N95, KN95 mask. We want medical grade masks, social distancing, washing your hands, utilizing home tests such that you can mitigate your behavior and control your environment in as much as possible. And lastly, we would like for everyone to remember that we are all in this together. This is not a singular disease. Your decision does not only impact you, it is a plural disease. Any decision that you make has the potential to impact hundreds and thousands of people around the world. If you need any indication of that, look at Omicron, first identified in South Africa on November 24th. Here we are on January 20th, still battling it in the United States. This is a plural disease and not singular. And so we absolutely want everyone to please practice kindness and consideration for one another. Thank you. I'm passing it on now to Dr. Jansen at Grady.
Oh, good morning and thank you. I don't know what else I can add. As I sit and listen to everybody else, it's kind of hard to add a whole lot of additional true information. So I'm gonna take a little bit different slant, if I may. I walk into the emergency room just about every morning. What is different now compared to what we saw in August or even this time last year? It's wall-to-wall stretchers. We have no capacity left at the hospital, and I don't think we're unique in that. This particular variant has been overwhelming to the healthcare systems. We have more patients than we've ever had. We've exceeded our previous peak by over 100. And on a daily basis, we continue to admit patients who are infected with COVID-19. One of the myths that we keep hearing is that, well, it's not that serious. Well, perhaps it isn't for some folks who are lucky, but COVID-19 is having a tremendous impact on underlying health disease. And so those patients who have other diseases such as heart failure, diabetes, sickle cell anemia, who are immunocompromised, if they get infected, they get incredibly sick, much more than they usually would get sick, and they wind up in the hospital. So when you hear that we're not seeing as many severe illnesses related to Omicron, perhaps we're not seeing as much Omicron-related COVID pneumonia, but we are seeing an overwhelming large number of patients who are ill, and that is caused by this virus. What impact is it having? Well, aside from being overwhelmed with patients, and we are running about 110% capacity right now. We've had to divert ambulances over the last several weeks because of the huge number of patients coming in. That has a big impact on the rest of the city. Grady is the trauma center for Atlanta. And when we have so many patients waiting in the emergency department for beds upstairs, we have to divert ambulances at times. This is not good for our community. It has a terrible impact on our patients who need to come here for the services that we are so well equipped to provide. We, continue to deal with the fact that our staff is impacted by this, not just because of the fatigue, the frustration that you heard about earlier, but they too are getting sick. And it's not because they're not doing things properly. It's because they're in this environment and they're in the environment at home. And so they become ill. When they're not here, our staffing goes down. So that adds additional stress to the remaining staff. This is a real interesting time because everybody's tired of talking about this. It's only been 2 years. I think today is the 2-year anniversary of the first case in the United States. We met in August to talk about this. Little did we think we would be talking about it again today, but here we are because a new variant is out. We've got to continue to do all those things that we've heard about earlier. But I also think it's time for us in healthcare to take a little step back and assess our role in this and some of the confusion. You know, this is an evolving disease. 2 years into it in the United States, a little over 2 years worldwide, we continue to learn. And so a lot of times the information that comes out is different from what you heard earlier. And we need to take responsibility for that as healthcare providers, because we need to admit what we don't know. We need to admit what we are still learning and provide the best information possible, but provide it in a way where people understand that we too are still learning what's going on. You know, what's the future? You know, we still are in this highest peak that we've had. There are people saying that it's getting better. We haven't seen that at Grady. We're at a plateau level. It may be improving in the next week or so. We're hopeful for that. But then we have to be ready, because this isn't going to go away. You know, COVID-19 isn't going to disappear after this wave. There will be other variants. I think we can assuredly say that. And we've got to continue to do those things that we know help. And you've heard about vaccines. I'm not going to reiterate all the things that have already been said. All I can say is use good sense, you know, be smart. We know what we can do to help prevent this. And the other thing is, you know, early in the pandemic, we had the heroes, the health heroes, and everybody was out banging on pots and pans. Well, now healthcare doesn't feel like heroes anymore. But we got to continue this, and I don't want us to become victims either. So keep doing what you know works. We're here to help when we can, but do understand this is real. This has been an overwhelming peak on top of an already fatigued staff. And I'm going to turn this over to Dr. Manapelli from Northeast Georgia.
Thank you so much, Dr. Johnson. I'm Dr. Supriya Manapalli. I'm the Medical Director for Infectious Diseases at Northeast Georgia Health System. And I'm very honored to be representing our health system today in this health briefing. My colleagues have already touched on most of the key points, so I'll try to summarize some of them and also share what we are seeing here. And as we all know, with the fifth wave here in our region with Omicron, which is highly contagious, we are seeing around 330 patients approximately admitted to our hospitals at this point of time. At our peak in fall with the Delta wave, we had around 333 patients. And last January, we had around 358 patients admitted at that time. If the projections hold true, we might pass the last January's peak. So we're continuing to monitor our numbers very, very closely. Like all health systems in our region, our emergency departments, our urgent cares, primary care doctors' offices are seeing record-breaking number of patients. And our healthcare workers continue to bring their best every day, show resilience, courage, kindness throughout all the challenges. And I continue to be inspired and motivated by them. There's so many patients, hundreds of patients we've taken care of, and some of those stories are so profound. The what ifs, as Dr. Brandstetter said, do not stop. Young girl I took care of a few months ago who was pregnant. We were able to save the baby by elective C-section, but mom, after a prolonged battle, did not make it. What if she was vaccinated? So many patient stories like that stay with us, and having access to the vaccines that are life-saving. Really hope we don't see as many of these now. Our staff, we're seeing record number of our employees out sick with COVID-19 due to the highly contagious nature of the Omicron. And in the last few days, we have seen that number downtrend a little bit, and we hope that continues. And again, I continue to stay optimistic throughout the pandemic and the challenges, hoping that maybe this will be our last surge, but only time will tell. But as a community, we have to come together to follow the basic precautions and take the preventive measures. I know there's some questions about the testing, the quarantine, isolation, the treatment, so I'll try to cover those briefly. The most important thing, as Dr. Morgan already mentioned, if you have symptoms suggestive of COVID-19, do not go to work, do not travel, isolate yourself immediately and get tested. While PCR is the most reliable test out there, if you use one of the home kits with a rapid antigen test, even if that test is negative, please continue to isolate and get a PCR test and isolate pending the test result. This is extremely important so that we don't spread the infection to others. Testing can be obtained at one of the testing sites, urgent cares, primary care doctor's offices. Do not go to emergency department just for a COVID-19 test. If the test is positive, based on the latest CDC guidance, it's recommended that you isolate for a minimum of 5 days if you have a mild to moderate infection. And if your fever is resolved with no fever-reducing medications, your symptoms are improving, then you can end your isolation at 5 days. Day 0 is the day your symptoms started. So day 1 is really the first full day of symptoms. And always consult your doctor to make sure you meet the criteria to end the isolation at 5 days. And even if you end the isolation at 5 days, it's extremely important that you do not travel in the next 5 days until the 10 days has completed. You do not go to restaurants, gyms, and also you're not around people who are immunocompromised or at high risk of having severe disease. This is very, very important. Also, regarding quarantine, if you've had a close contact with someone who is positive for COVID-19 infection, if you're up to date with your vaccinations, including the boosters, additional doses, you do not need to quarantine, but you should monitor your symptoms very closely. Wear a mask, well-fitting mask, as my colleagues have said, that covers your nose and mouth, and that's not a chin diaper, and that fits snugly. You should wear it when you're around others and monitor your symptoms very, very closely. If you develop symptoms, you should get tested immediately and isolate pending the test result. If you're not vaccinated, or if you're not up to date with your vaccines, including the boosters, additional doses, or if you're not vaccinated, you should quarantine for at least 5 days. Day 0 is the day you had the exposure. So the next day is day 1. So always consult with your doctor to make sure you get the appropriate guidance. For someone who is confirmed as having COVID-19 infection, if they don't have any symptoms, they should still isolate for at least 5 days. Day 0 is the day they got the positive test result. If they develop symptoms anytime during these 5 days, then they should isolate for another 5 days, day 0 being the day they develop the symptoms. And for those who have a confirmed infection with symptoms, it's extremely important that you talk to your doctor if you qualify for any of the treatments available. So much has changed in terms of outpatient treatment for COVID-19 that gives me a lot of hope. One of the access to antivirals, it is true the supply is limited, and that is very frustrating for us as healthcare providers, but I hope that changes soon. Also, availability of the monoclonal antibody sotrovimab, which is what we are using now. And as Dr. Morgan said, we're having to prioritize to those who are at the highest risk of having severe disease or dying from the infection. So our health system is following the National Institute of Health prioritization tiers to whom we administer the sotrovimab. And for the antivirals, we're so thankful for the collaboration with our pharmacy experts who continue to provide us guidance in terms of which local pharmacies have availability of these antivirals, the Paxlovid or the molnupiravir. Please talk to your doctor because these antivirals should be started within 5 days of the symptom onset. Also, again, the other one that gives me a lot of hope is the Evusheld, which is the pre-exposure prophylaxis monoclonal antibody. This is for those where the vaccines may not mount the adequate immune response to protect them, or those who cannot get the vaccine because they have a contraindication due to severe allergy. And this does not replace vaccinations. That is one most important thing to remember. And our health system is also working to ensure those who are immunocompromised, who meet criteria, have access to this pre-exposure prophylaxis therapeutic as well. And again, as others have said, vaccines, it's extremely important that we stay up to date with our vaccines. Get your information from the most reliable sources. Anyone 5 and above in our country has access to the vaccination. So it's so important that we talk to each other. We stay patient with those who are, it's hard, but we need to continue to stay patient, answer the questions for those who are trying to still make the decision to get the vaccination, and stay up to date with the vaccinations. Get your boosters, get your additional shots. And we cannot forget the importance of the basic infection prevention practices. The 3 W's: wear your mask, wear a layered, well-fitting mask that covers your nose and mouth, wash your hands, watch your distance, avoid crowds, monitor for symptoms. And if you have symptoms, immediately isolate and get tested. We're all in this together. And again, I hope the end of the pandemic is not too far off, but we'll continue to learn and take care of our community and each other. Thank you.
Thank you to everyone that provided insights this morning. Very helpful to hear your comments. And so we have a few questions that have come in from our chat. And so I wanted to start with Dr. Brandstetter. Dr. Brandstetter, we've had a few questions. This is a 2-part question for you. You spoke about a family who came in and were later diagnosed with COVID. They didn't come in initially for COVID. Was that family hypothetical or real? So that's one. And then secondly, we're hearing from some readers who hear that Omicron is mild and that indeed people are getting infected, but they believe that if people get severely ill and die, it's not a result of COVID, but it's a result of another condition. Can you speak to that as well? So first is about the family you spoke about, and the second is the conditions for the severe illness and death.
Thank you for very important clarifications in the questions. Unfortunately, and dishearteningly, that isn't a very, very real situation that was faced by a family. So that is a unfortunate, tragic event that, again, what if could have been prevented. That's the very saddening, and I can't say how every day we face very similar situations of this could have been different. And the vaccinations, while may not prevent infection and even symptoms from COVID, can prevent the deaths and the severe illnesses. And the humbling thing about COVID-19 is we are not able to predict who will have these severe complications. Long-haul COVID, a comorbidity that is devastating and life-changing, such as an overwhelming stroke. So to answer the second part of the question, is the mortality from COVID-19 or some other incidents, particularly those who are subsequently diagnosed with COVID after presenting from another illness? So COVID-19, most of the time when they're admitted for COVID-19, is the cause of death. When someone is admitted for another etiology and subsequent diagnosed with COVID-19, COVID-19 often contributes to the morbidity and mortality. It may not be the primary responsible etiology for their death, but it is certainly contributing. Let me give you a few examples. A young gentleman in his 20s presented with an acute heart attack, died from his heart attack in his early 20s with no risk factors. Turns out that he was COVID positive. His increased clots and devastation from those was caused by his COVID-19 infection. So he did not die of COVID pneumonia or the infection. He died from the heart attack that was a result of the thrombosis caused by his COVID-19 infection. So yes, people are dying from COVID-19. They're diagnosed with other etiologies and present with those, such as strokes, heart attacks, blood clots to the lungs, renal failure, worsening heart failure, all worsened by COVID-19. And the severity of those illnesses can be significantly reduced by vaccination and prevention. Thank you.
Thank you very much. So, Dr. Morgan, I'm going to come to you next, and then Dr. Jansen after Dr. Morgan. Dr. Morgan, are people trying to intentionally contract COVID, as you mentioned?
Thanks for that question, Katie. And that is a big concern. And I have gotten that question so many times until it is a concern. And I think certainly there is a cadre out there within the United States that certainly is tired and exhausted and thinking that maybe this is the way to get to the end, because people can't really see their way out of that. And so hopefully that is not happening, but I have to say that in some cases it probably is, because I have gotten that question so many times that is a reflection then of what some in society are also thinking. And so I want to reiterate, certainly at this time, but this particular variant, that is a terrible idea. We have staffing issues. We have therapeutic shortages. We are triaging care. This is not the time to take a risk like that with your life. You might be lucky, but you might not be. This is not a virus that has killed no one. So we want to be clear about that. This is not a strategy that we are supporting as a scientific community for you to move forward with intentional infections.
Thank you, Dr. Morgan. Dr. Jansen of Grady, some of the state data suggests that Georgia, or maybe at least Metro Atlanta, has peaked. Do you believe this is so? And what does your health system foresee in the weeks ahead?
So I'm hearing from some of my colleagues, they're beginning to see some decrease in the number of cases in the hospital. Like I said, at Grady, we've not quite seen that. We did see a slight dip in the number of admissions. The thing to remember about this, though, is we now have so many patients who are hospitalized across all hospitals that even as the peak subsides, the number of cases already hospitalized is much larger than what we've seen in the past. So, we've seen in other countries that the cases start going down. I am hopeful that that's what we're going to start seeing both at Grady and across the city. But COVID is also sort of a local infection. I know we talk about state statistics and US statistics, but it's a local community phenomena. And you may have outbreaks that are in certain communities that impact that local health system that you're not seeing in other parts of the city. So some of that phenomena, I think, is the reason we're still seeing as many patients as we are, and others may be seeing a decrease. If you look at what's going on across the state and across the US, it seems to not only start in a wave, but it is a wave that goes from community to community, from urban to rural, from state to state. And so it can be a little deceiving when you look at large statistics across large populations to know what's going on in your community.
Thank you, Dr. Jansen. And I am actually going to go to Dr. Shane of Children's Healthcare. And you certainly highlighted in your comments about the impact on children with the Omicron virus, but you also have a good eye on the whole state, given that you are our children's healthcare resource for the state. And I'd be curious, do you have any concerns for the health systems that are in more rural parts of Georgia, given what you've seen from this variant? We do have significant healthcare capacity in the region, but I'm curious from a statewide perspective if you have any thoughts. That's for Dr. Shane.
Thanks, Katie, and a fabulous question. Yes, we have tremendous concerns about rural access to care. We're very fortunate to be located in Atlanta, but once again, we have many pediatricians in the community who are really struggling with children who are COVID infected, whether or not those children are going to progress to needing higher levels of care that cannot be provided in regional hospitals. It's a tremendous concern. And also just having familiarity with taking care of children. Several people have discussed the challenges of post-infectious complications. And it can be very challenging if you're caring for a child who may or may not have underlying medical conditions, who you're concerned may progress and you may not have the capability in your local facility to take care of that child. So I would say that rural access to care is a tremendous concern in both the pediatric and the adult population.
Thank you. Sharon with Emory, I'm going to come to you next. You mentioned about ICU nurses not being able to give maybe the highest care a patient needs or may have to prioritize the care that is given. Can you maybe describe what that looks like specifically, and what is the effect you have seen on the nurses?
Sure. The way that we're wired as nurses is that we don't want to leave anything out. We believe everything is important, and I think that's wonderful. But I will tell you that we have been able to sit down with the nursing staff and actually talk through with them what we hear are things that might be things that we could put on the back burner, like documentation requirements. We like to be comprehensive with that, but what are the very essential things that other people need to know about this patient that are essential for our documentation? And we're prioritizing those things so that we do have good communication across clinicians as well as from one day to the next. So documentation requirements is one area that might look like. We also have been able to augment some of the nurse staffing with other levels of technicians, and even to the point of other levels of individuals who are just willing to volunteer, such as nursing students. We've been able to bring those folks in to augment the nurse who might have an additional patient today that under normal circumstances she would not have that number of patients. And so we're just really trying to prioritize the must-have patient safety, quality care things that are must-haves, and making sure that we keep the nurses supported as best we can with other different types of clinicians and partners as they provide care to patients.
Thank you, Sharon. And we have time for one more question, and I am going to go to Dr. Manapelli of Northeast Georgia. And really the purpose of being here today is again to encourage the public to follow the recommendations of our healthcare providers. And so I'd like to ask you, do hospitals feel that outreach efforts and public announcements and pleas like this that we've heard today are being heard by the public? And is there anything that those listening today could do to help amplify the messaging?
So yes, and they are being heard, but we have to continue to reinforce them. That's the most important thing. After 2 years of being in this pandemic, everyone is just tired of hearing the word COVID, but we're still here in the middle of our 5th wave, and we just have to continue to reinforce. In our community here, with our Hall-In campaign, where we involve our community members, leaders, we continue to reinforce the importance of getting vaccinated, staying up to date with the vaccine, and also, again, the 3 W's about wearing the mask, washing hands, and watching your distance, avoiding crowds, all of this. So this is an ongoing effort that we continue to use our social media pages and through our Hall-In campaign. And we have to, as leaders, as healthcare leaders, we have to continue to reinforce that message that we're still in it.
Well, thank you to everyone who submitted questions, and especially to our experts who were here to provide commentary and answer questions. I know there were a number of questions that came in that we were not able to get to. If you are a member of the media, please direct any remaining questions following the program to the PR teams for each of the health systems represented here today. And again, we appreciate these healthcare heroes and leaders for being with us today, as well as everyone that participated in today's event, who are going to amplify the messages that we heard. So we're grateful for the collaboration and dedication to the health and wellness of our citizens. And to recap, COVID-19 is not over. We are still in a pandemic that is impacting our communities and health systems. We hope this press conference has helped you to further understand how COVID-19 continues to affect our city, our state, in our communities. Thank you, and wishing all of you a healthy day.
Thank you very much.